Hi, Mr. George, is it?
That's right, yeah.
Hi, Mr. George. My name's Dr. Barnes. I'm one of the general medical doctors. I've come to talk to you today about what brought you in last night and how you've been getting on.
I've been getting on since I've been in here.
Mm.
I came in here last night. I sat around for 6 hours before I was seen by anybody. Finally seen by a consultant. Taken off for some scan or other. I'm laid on a bed next to somebody who's rattling on. I asked somebody, could they give them a sleeping pill to try and shut them the heck up? They said, no, we can't do that. The pillow that on the bed that I was on was absolutely filthy. And then the consultant comes back and says, oh, no, there's no problem with the scan at all. That's absolutely fine. Why he couldn't have said that when he did the scan? I mean, surely he could have seen that at the time. And then says, oh, yeah, well, can you just hang around? You might need this other lumbar puncture thing doing. And to be fair, I'm not very happy.
Sounds like you've had a pretty rough time of it.
Yeah, understatement.
Yeah. The first thing to say is, look, I can only apologise for that. You know, dirty beds. That's just really not acceptable, and I will raise that, and we will look into that. Okay.
Yeah.
What I'd like to do is talk a little bit about the headache that you had, and some of the medical bits of that in the scan as well. Okay. And then perhaps at the end we can talk some more about some of your specific complaints. It does sound like you did have to wait too long. And if you would like to make a complaint or anything, I can direct you.
Well, I thought you were only meant to wait 4 hours.
So we do have a target to wait 4 hours, but particularly at night, things can be very, very busy. Staff are very stretched, and that's not an excuse. Okay, that's not an excuse. But
I'm not blaming you. You understand that? But
yeah, no. I can only apologise for what's happened, and we can talk about where we're going to go from here with that. But before we do that, I'd like to talk about you because your health and why you're here. That is actually the most important thing. So if we just talk about the headache, so could you tell me a bit about the headache that you had? Or
it just happened, and yeah, there was nothing. Then suddenly I felt like I'd been smacked round the back of the head with a tennis racket.
Wow.
They said it could be a blood clot, but then I think this scan said that it isn't a blood clot. And then they've given me some painkillers, and now it's gone away. And I don't know. I assume that I'm fine, or maybe is it going to come back? I don't know, but I hope not. But
okay.
it knocked me to my knees. I've got to be honest. Well, obviously I wouldn't have come into here if I just had a bit of a headache.
Okay. Do you normally get headaches, or have you had anything like you never had anything like this before?
No.
Okay.
I mean, you get a headache now and again, but no, I don't get headaches as a regular. No.
Okay. So I mean, headaches are. Everyone gets headaches, as you know, and they range from very innocuous to very serious things. And it sounds like this was quite a worrying one for you, and certainly a worrying one for us, which is, why we've kept you in. Some of the more serious causes of headache include, structural problems with the brain, and also things like bleeding, brain hemorrhages, which I think is probably what they are worried about for yourself.
That's what I mentioned.
Particularly something called a subarachnoid hemorrhage, which actually, in a lot of people, does feel like they've been hit around the back of the head quite, with something very hard, and can be quite crippling with a degree of pain.
So is that ruled out by this that I had last night?
So the best test for a subarachnoid hemorrhage is a CT scan of the brain, which you've had, and yours is negative. Okay, and that's reassuring. It doesn't completely rule it out, but with a high degree of certainty, it means that it almost rules it out, okay? What we often do with people with this kind of headache, just to be sure, because if you don't pick up a subarachnoid hemorrhage, it can progress, okay? And it can be extremely serious. So to be very sure, and also to rule out a few other more serious causes, such as infections in the brain and stuff, we do normally do the lumbar puncture afterwards, which I think might have been mentioned to you. So what's anyone said about the lumbar puncture?
That's what they now want to do.
What are your thoughts about that?
Well, the headache's gone away. And you're saying that this scan that I had pretty much rules out there being anything. So it was a headache. I mean, all right, it was a severe headache, but it was a headache and it's gone. I don't really see the point in having any more. And how long is it going to take as well? Because, I mean, based on last night, I could be in here for another day.
Well, like I say, I can only apologise again that you have had a delay and you have had to wait a lot.
I know.
It does sound like it's been really tough. What I would say as well is, you're a fit, healthy guy. So although the scan is very reassuring, it would be ideal to more completely rule out the subarachnoid hemorrhage, because, as I say, it could progress, and sometimes the pain goes away and then it can come back, by doing a lumbar puncture, okay, which is another test. I know you initially said you just want to go home, but...
Well, who would do it? And how long would it take? And how long before I get the results back as well?
Okay.
Or do I have to wait here to get the results back, or can I go and...
So, do you know... Well, just before we address those questions specifically, do you know anything about a lumbar puncture?
No.
Okay, so it's a diagnostic test. It involves taking a very small sample of fluid from the back, okay, with a very small needle. It would be done by either myself or one of my colleagues who is experienced with this and has done many of them, okay. We would make sure we do it, as soon as possible, okay, because we don't want you to have to wait around anymore. So we normally like to do it 12 hours after the onset of the headache. So, if the headache was last night, that would be this morning sometime.
Yeah.
So as soon as we get to 12 hours, we would do it as soon as possible, okay. And we can normally get the results back pretty quickly.
What's pretty quickly?
So normally we can get most of them back within a few hours. Okay.
So I'd be waiting here then.
Ideally, we'd keep you to wait here, but we could get you out of this ward, into a more into a chair or something, and maybe have a drink or something.
Okay.
Okay.
Yeah.
Now, in terms of what a lumbar puncture entails, we would have you laying on the bed. Okay. We clean your back with some cleaning fluid, and we put a little bit of local anaesthetic under the skin, and that sometimes stings very slightly. We then use a very small needle, smaller than the drip you would have had put in your hand, and that goes into the back, okay? It goes in a good few inches below where your spinal cord finishes, okay? And we just take some fluid. The whole process probably takes about 30 minutes in total. Okay? It can be a little bit uncomfortable, but it shouldn't be particularly painful. Okay? And as I say, the needle is a long way away from the spinal cord, but there are little nerves that come off the spinal cord, so there is theoretically a very small risk of irritating one of those nerves. Sometimes you can get like a shooting pain in your leg, like when you've banged your elbow or something, okay? It's normally very transient. I mean, how does that sound as a general?
And you think it's important that I have this?
I think it would help us with a greater degree of certainty rule out a subarachnoid hemorrhage, or detect it if it was there, and therefore treat it very proactively. Which, as I say, although it's unlikely, it could be very serious and something we wouldn't want to miss. Does that sound...
Yeah, that sounds all right.
Okay.
Yeah, let's do it.
So, there's a few specific risks. There's about 1 in 200 chance of getting another headache afterwards, okay? Normally not quite like the one you've had, but you can get a bit of a headache afterwards. As I say, there are some small nerves. There's a very small risk, probably 1 in 10, 20,000, of causing a bit of an irritation of a nerve, okay? So you can end up with a little bit of numbness or weakness in the leg, which normally resolves. The risk of anything permanent would be more like 1 in hundreds of thousands, okay? So it's a risk, but it's extremely small, okay? And then there's also a very small risk of bleeding and infection, but we've done some blood tests which would suggest the bleeding's unlikely, and we clean the back and use sterile cleaning fluid to minimise the risk of any infection, okay? It's not a risk-free procedure like any procedure, but the risks are relatively low. Okay?
You're telling me as a doctor that it's worth the risk in comparison to... Even after I've had this scan, to have it done.
I think the risks of something... I think the risk of an adverse outcome with a lumbar puncture is present, but is small. But I think the risk of an undetected subarachnoid hemorrhage, the severity, the seriousness of that would probably outweigh that. Okay. Can I just check? So can you... I know it sounds a bit silly, but can you just repeat back to me what I've said just to summarise it so I understand you've understood?
So... what you're proposing to do will take about half an hour.
Mm-hmm.
You'll clean my back, stick a needle in there, take a sample, and then you get me some results in a couple of hours. Yeah. And I can go home if everything's all right.
Yeah. And like I said, I think on balance it would probably be the most sensible thing to do. And then afterwards we can talk exactly about, what's gone on since you've been here. And if you do still want to make a complaint, we can support you.
I just want to go home is the truth of the matter.
Do you think we should proceed with the lumbar
Yes,
puncture?
yeah. Let's get it done.
Okay, let's get that done, and we'll see how you're feeling after that.
All right.
Thanks very much.
No, thank you.